I think it's interesting that here in the US there has been this sort of consistent opposition to the concept of health as a human right, and the US hasn't ratified this treaty that I just mentioned, the Covenant on Economic, Social, and Cultural Rights, and opposed the creation of the mandate of the Special Rapporteur. Was one of the very few states that did so. But I think it's interesting in the current climate because there are indications that that's starting to change. And I just wanted to refer back to the comments that were made during the second presidential campaign debate, where the candidates were asked whether health care is a right, a privilege, or a responsibility. And I found the answer that then Senator Obama gave to be very interesting. He said, "I think it should be a right for every American in a country as wealthy as ours for us to have people who are going bankrupt because they can't pay their medical bills, for my mother to die of cancer at the age of 53 and have to spend the last months of her life in the hospital room arguing with insurance companies because they're saying that this may be a pre-existing condition and they don't have to pay for her treatment. There's something fundamentally wrong with that." And I think his answer sort of, again, hints towards a shift, but it also reflects feelings shared by many people, both in this country and in other parts of the world, in the face of health inequities. So again, I think today there's a growing appreciation of the linkages between health and human rights, and the recognition of the importance of the right to health itself. And I think part of that, again, is a bit of a shift in the international human rights community. While a lot of the focus was on bringing legal cases to action the right to health, there's now more of an understanding of the importance of health as a human rights in health policy and sort of efforts to integrate human rights into health policy. I just wanted to give one example, which I think really illustrates these linkages, which is maternal mortality. And I'm not saying that just because I think half of our panel is pregnant right now. But for me, these statistics are really very, very shocking. Their reproductive health problems are the leading cause of death for women of reproductive age in developing countries. And there are over 500,000 women die from pregnancy-related causes each year. And globally, over 300 million women live with illnesses due to pregnancy or childbirth. But 99% of these deaths occur in developing countries. Even within developed countries, I think the inequities are really massive. And in the US, for example, the rate of maternal mortality is 1 in 2,500, which is extremely high, one of the highest among industrialized nations. But the rate among African American women is almost 4 times that of non-Hispanic white women. And again, it's socioeconomic inequities and not a lack of medical solutions that determine these health outcomes for women. For example, factors that increase the risk of maternal death relate to delays in seeking care, and in some countries that's to do with cultural issues around where women have to get permission from male members of the family to travel, for example, where there are delays in reaching emergency care due to lack of transportation, and delays in receiving care from providers where there just aren't enough staff or the facilities or care is just unaffordable. And so again, these rates could be drastically reduced by building well-resourced, accessible, and community-based health systems which respond to the health needs of women. So just thinking about what the obstacles to the realization of the right to health are, I think there are examples in the case of maternal mortality, and I'll just focus on one, which is this inequitable access due to weak health systems, including the lack of skilled health professionals. This is a key challenge, and now there's a great deal of attention being focused now at international and national levels on this issue. And there's much more sort of support going into building strong health systems. I think part of this is in recognition to the fact that the vertical health interventions have only sort of had limited success, including some of the disease-specific initiatives. There's recognition that without the health systems in place to deliver these interventions, any of these initiatives are going to be sort of limited in their success. But from a human rights perspective, the results of these efforts to strengthen health systems depend on how the human and financial resources are distributed, whether they're community-driven, and whether the health systems are designed and implemented to meet the needs of the most marginal parts of the population, and with their participation.